I am Mathieu Allais, I work in Paris in Hospital Saint-Louis.
I'm Heniti and I'm a gastroenterologist from Israel.
I'm Torsten Kuchatzik, I'm a gastroenterologist from Lüneburg.
I work at the Rabin Medical Center and I'm also the head of the IBD Society in Israel. The workshop as it's built is aiming to allow interactive discussion between the IBD experts who present the cases and the attendees that are usually young fellows starting their career in the field of IBD and getting the opportunity to learn from experts how they solve everyday questions.
Have to really acknowledge some things right now. We have heterogeneity in IBD, so I usually tell to residents that no two IBDs are the same. Workshops like this are absolutely important so that we have some degree of standardization of care across all the countries, and these workshops give a nice clinically based approach to various scenarios which gastroenterologists see on a day-to-day basis.
What we've come to learn from other groups, and this is from Hans Gievers looking at kids, that the microbiome becomes a mess.
I'm Dr. Charles Bernstein. I'm a gastroenterologist and a professor of medicine at the University of Manitoba. I was discussing an aspect of the epidemiology of inflammatory bowel disease, which means who gets the disease and why might they get it. I believe that what's triggering the disease in India may be very similar to what's triggering the disease here in Portugal. We just have to try to understand what those triggers may be that are common.
So my name is Tine Jess. I'm director of the National Center of Excellence for Studies in Inflammatory Bowel Disease in Denmark. What I discuss today is the impact of gender on IBD. Do we see IBD occurring more often in women than in men, or the opposite? And the short answer is that there are no big gender differences. We see IBD almost as often in women as in men. It changed a bit depending on when in life you're diagnosed, but fairly the epidemiological evidence shows that there are no big differences.
So I discussed Crohn's after surgery. The question is, do we completely reset the disease, or do we have, at time just the surgeon makes the anastomosis, all the components for disease recurrence? To put this all together can help us also as clinicians to better manage this period, which is an opportunity for the patient, because the patient goes to surgery. Then the objective is to maintain remission over time.
Estou feliz de estar aqui com você. Muito obrigado, Professor Marco and the organizing committee.
So randomized controlled trials determine how we treat our patients, and we need to ask ourselves what are the advantages and what are the challenges with randomized controlled trials, and does real-world evidence give the answer?
I discussed the topic immunosuppression and infections, and this is still a very hot topic as we are having more and more immunosuppressive drugs that are using for IBD, and each of the drugs has its own risks, so prevention of infection is more important than ever, and we have now a variety of methods to prevent infection, and one of it is vaccination. So vaccination becomes more and more important in our IBD population.
Why do you need a pathologist? I think the two previous speakers have already answered some of those questions.
I'm Roger Feekins, I'm a pathologist at the Royal Free Hospital in London and University College. Well, I'm talking about the importance of a pathologist for the gastroenterologist, and there are various ways in which we help, making a diagnosis, classifying the disease, and then there's one area where the gastroenterologists really do need us and they can't make the diagnosis on their own, which is dysplasia and tumours.
enfermagem, especificamente em DAI, é fundamental para todos os enfermeiros que façam a prestação de cuidados à pessoa com doença inflamatória intestinal.
Dear colleagues, on behalf of GEDII board, let me thank you for your participation in our meeting. This year, 2022, we shared with all our Portuguese colleagues the recent knowledge in IBD, from epidemiology to the new therapeutic approaches. It was a moment of learning, sharing, and also social interaction. And we hope we can see all of you next year on our next meeting that will take place on April.